The World Health Organization has categorized Kenya as a high-risk area for the deadly Ebola virus transmission due to its geographical location and position as an aviation hub. This announcement came on the heels of the Kenyan Ministry of Health request for 535 million shillings from the National Treasury to help set up adequate response structures.
A coordinated international response is deemed essential to reverse and stop the outbreak. So, the declaration calls for international response to the outbreak. And the declaration provides a specific action to be followed by three major categories of countries. One, the affected countries. Two, those that are at high risk of transmission. And three, all unaffected countries. If we consider our geographical situation of our country, Kenya, we can easily classify Kenya as Group 2, meaning those at high risk of transmission.
Kenya receives more than 76 flights from the affected countries every week, many operated by Kenya Airways, Ethiopian Airlines, and Rwanda Air. 76 flights every week. There is therefore heavy human traffic between the affected countries and Kenya. Hence the need for enhanced preparedness for prevention of possible introduction of the virus into the country and early detection and response.
Kenya is a regional aviation hub connecting the continent to the rest of the world. Kenya Airways has several daily flights to different parts of West Africa, which has been severely affected by the Ebola virus. The airline in a statement said it would continue with flights to and from West Africa as it continues to monitor the situation.
The ministry has been working with the airlines to screen travelers who come from or transit through West Africa. For such travelers, a minimum package of information, including personal details, exact location of origin, transit, and presence of any suggestive signs and symptoms, are collected to aid personal risk assessment and daily follow-up for 21 days if they are still resident in the country. To date, I can report that we have screened more than 10,000 travelers from West Africa. The ministry has established temporary holding rooms at the Jomo Kenyatta International Airport, where suspected cases of Ebola will be retained and assessed further while awaiting possible transfer to isolation facilities.
This Ebola outbreak first emerged in Guinea in March and has fast spread to neighboring countries, Sierra Leone, Nigeria, and Liberia. There are over 1,800 Ebola cases with slightly over 1,000 deaths. Sierra Leone has been the most affected.
The levels of preparedness were very low, and the reason why it was quickly spread in other countries. And now we know that Nigeria is also affected. The outbreak is complex, with now multiple locations as a result of cross-border movements among the communities, and a large number of cases have occurred in peri-urban and rural settings, which constitutes also a major challenge for effective control. And we know that in peri-urban areas, there are crowded settings, and we know also that in many rural areas, the health system is not that strong.
Kenya has adopted a 10-pronged strategy to curb transmission of Ebola. The country's largest referral hospital, Kenyatta National Hospital, has been equipped with an isolation facility to cater for any suspected cases of Ebola. The government further said an assessment of additional isolation facilities in major towns across the country, especially at port of entry, was ongoing.
The ministry has been working with the airlines to screen travelers who come from or transit through West Africa. The ministry has established temporary holding rooms at the Jomo Kenyatta International Airport, where suspected cases of Ebola will be retained and assessed further while awaiting possible transfer to isolation facilities.
Clinical trials for an Ebola vaccine are expected to begin in September. The World Health Organization expects it to be available by 2015. But in the meantime, another treatment has been tested on animals with promising results.
We are referring to Zinmap, which has only been studied in non-human monkeys, and it was administered to 2 Ebola patients under emergency conditions. There have been no clinical trials to test its safety, and therefore it has not yet been formally approved by any regulatory body, such as the FDA in USA, or the Swiss Med, or any other national regulatory agency of medicine.